I think we'll continue to see a tremendous growth of the non-surgical procedures. Your vision of 20 years ago, I think the men caves of the world, it's been a tremendous change in our lives. I'm sitting here. The last people that left my office are my three master estheticians from Park City, super busy, want more lasers, want more products, want more. They always come to me with, I want this, I want that. And when you look at the bottom line, they are very busy, In the beauty is the products are better, the technology is safer. So I think that's, to me, I think our generation, that we're basically core surgeons, and to see that transition, to me, that was amazing.
Hello, everybody, and welcome back to the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the aesthetics business. And today is no exception. With us today is Dr. Renato Saltz, one of only two human beings on the planet Earth to be president of the International Society and the American Society for Aesthetic Plastic Surgery. Welcome, Dr. Saltz.
Thank you, Grant. It's a pleasure to be with you. Thank you for inviting me.
It's my pleasure. And Dr. Saltz is at his office in Park City. Is that correct?
That is correct.
Right,
Park City. Yeah, Park City, Utah.
Yeah. Thank you very much for joining us today. Dr. Saltz, could you first start out and tell us a little bit about yourself? Where were you born and where'd you go to school and so forth?
Sure. And before I do that, Grant, I told you before we start recording, but I think it should be documented. I want to congratulate you for your podcast. I want to congratulate you for, bringing this marriage together, industry and aesthetics. We always talk about it. You, such a pioneer. You always bringing the true disruptor in our specialty, and you know how much I appreciate that. I'm a big fan, and thank you for doing this. If someone had to do it, it had to be Grant Stevens. So congratulations.
It's my pleasure. I love doing it. Thank you. So tell us.
Where were you born? I was born in a small town at the border of Brazil and Argentina, right across the bridge, and which is called the Pampas region. And you, as a gaucho, you are, you know that region very well. So we grew up, riding horses and hunting, not very different than my good friend Grant Stevens. And then when it was time for medical school, I had to move to the capital of the state, which is Porto Alegre. And I went to a medical school at the Federal University. Then I moved for my training. I always wanted to train. I always thought to be a complete plastic surgeon, you had to do general surgery first. In Brazil, those days, this is early 80s, was a 3-year program. And you finish medical school and you're a plastic surgeon. So I thought that was not enough. So I was lucky, got my residency in general surgery in Miami at the University of Miami, Jackson Memorial Hospital. Did my 5 years of training there, got my boards in general surgery, and then went to Alabama with under Louis Vasconez for plastic surgery. And that was basically medical school and training in the South.
So you left Brazil and you came up to Miami to do general surgery. Is that correct?
That is correct.
And what were you thinking? What was the thought process? You left your family, you left your home, and you came up to the United States. What was going on? Did you just want to train in Miami, or were you following a girlfriend?
I knew back in high school, my first business, Grant, and you probably don't know this, I was a photographer. I used to do weddings and bar mitzvahs and baptism. I was at 16. I had a very good business doing videos, and not videos, Super 8 millimeters those days, in photography. And as you know, those days, a lot of the plastic surgeons used to refer their patients to a photographer for before and afters. It was all done in black and white. So we work in my studio. And I started getting involved at 16. I started getting involved with these local plastic surgeons. and really enjoy what I was seeing. And then they started inviting me to come to the OR to do intraoperative photos. And that's really how I decided back then in high school that I wanted to be a plastic surgeon. So, in talking to some of the top names in Brazil, I realized I need to get better training than would they offer me at that point in this town. So that's how the whole concept of I need full training in general surgery, I need a great program in plastic surgery. But that was pretty much set up when I was 16 years of age, believe it or not.
Yeah, I didn't know that.
Yeah.
So then after you trained with Dr. Vasquez, you left and you went to Utah, correct?
No.
Nope.
Before I left, I spent a year with Jim Grotting doing a microsurgery fellowship. And that was terrific because, as you know, Jim is a great surgeon, great teacher, and I really focus on breast cancer reconstruction. And I had a short stay at the Medical College of Georgia in Augusta, and then the University of Utah was looking for someone to sort of organize their breast cancer reconstructive program, and that's why I ended up in Salt Lake City.
And how long were you there?
I was there for 10 years, full-time, University of Utah, doing breast cancer reconstruction, in charge of that department, doing a lot of aesthetics, doing hand surgery, doing microsurgery, burns, the whole thing. And then in 2002, I decided to take a clinical appointment at the U and move into private practice. And that's where I set up offices in Salt Lake and in Park City. And it's been fun. It's been a great place to practice, raise the family. We really enjoyed the mountains of Utah.
So you have two offices, and do you primarily do aesthetic surgery now?
Almost 100%, Grant. I still do occasionally breast cancer reconstruction. I'm not doing microsurgery anymore, but I would say 80-90% it's all aesthetics.
And how has COVID affected you in terms of your practice?
The first 6-8 weeks, they shut us down. I was very worried. We chatted at the time. We all didn't know what was going to happen. It gave us an opportunity to reconstruct the practice, look at staff, find new staff members, really rebuild the office in a sense of let some people go and bring some new people. And when we reopened in May, I felt very good about it. And it's been very busy, as you know. The two med spas have been extremely busy. The surgical practice has been extremely busy. It's been a very interesting recovery, despite a pandemic, despite losing so many Americans, so many people worldwide. I think for aesthetic surgery, it's been surprisingly a very interesting recovery.
So you're very busy in surgery and non-surgicals, correct?
Yes.
And what sort of precautions are you taking for your patients?
We're still doing masks. We're still checking temperatures. We're still following guidelines from the Salt Lake County and Summit County in Park City. I still take it very seriously. Thank God we haven't seen any issues among staff or patients. Everybody is vaccinated now in my practice in both locations. As all of us are taking this very seriously, I don't pay attention to all the conspiracy theories. I think it's a medical issue. It's a crisis, and we're in medicine, so we need to take it seriously.
I agree with everything you've just said. So I'm going to change gears a little bit, and now I want to go back to the beloved Aesthetic Society, the American Society for Aesthetic Plastic Surgery, which you've been not only a president, you've been a trustee, you've been the chairman of the board of trustees. There's many, many things. Tell us a little bit about your relationship with the Aesthetic Society and some of the things that you've been involved in that you're passionate about.
Wow, where do you start? That's our family. That's our national family, and your family.
No, we're gonna get to the international in a moment, but for now, the American.
It's been terrific. I became a member in '96 together with Sue Dykema, when she
Mm-hmm.
just joined the group.
I'll be darned.
I have wonderful memories. I work under Bob Stanton, Linda Stanton, uh, met most of my dear friends and brothers at ASAPS. It's still the meeting that I look forward because we have our get together. It's where I learned aesthetics. It was where I taught aesthetics. All my mentors are there. My idols like you are there. It's really a wonderful group, and it's one of the great honors and privileges to be able to serve at that society and eventually become their president. But I have wonderful memories, and the fact that we're getting back together in less than a month in Miami is just it gives me the goosebumps because
Me
I'm
too.
so looking forward to that.
I must admit, so am I. And you have contributed so much. And
All
I
of
know
us did. All of
you
us did.
also supported my candidacy and so forth. And I thank you very much. And I feel like it's my family. And what would you tell a young surgeon listening to this podcast as it relates to the Aesthetic Society?
I think young surgeons. It's exciting. I think they are facing aesthetic world much different than you and I did.
Mm-hmm.
Sometimes we couldn't even talk about aesthetic surgery in front of our professors. I think you had a great chief. I had a great chief that allow us to. I think it's a much better world now that welcomes aesthetic surgeons. But still, you gotta go through the whole thing. You gotta have a solid training. You gotta go through the general surgery. You gotta take good care of your patient. Patient safety always first. Don't get lost into the marketing, into the social media. Be a doctor, be a great surgeon first, and use mentors. I think what ASEPS does that no other society does. We're trying to do that at ISEPS, but it's harder. Is the opportunity to find mentors. They text you and they call you. Next day they are following you in the operating room. They're following the great Grant Stevens in the operating room. They can follow Robert Singer. They can follow Fuana High. They can come and join me here or in Salt Lake. It's a small world and we're all very close. I mean, look at how many people you train and you mentor. So I think ASEPS was the beginning of that relationship that we have now among ourselves and with the young people. And that's what I tell. The residents rotate with me, the fellows rotate with me. And I said, the first thing you do, you start going to the ASEPS meeting and you go there and you learn and that's going to be your family in 20, 30 years. Those are your friends and colleagues.
Mm-hmm.
So
I couldn't agree with you more. Now, some of the people that are watching right now don't know about ISAPS. So you're a past president of the International Society of Aesthetic Plastic Surgeons. I want you to describe ISAPS, maybe the number of countries, maybe what they do, what the mission is, and so forth, and assume they don't know, because many people watching this do not know about ISAPS. So what is ISAPS, and why are you involved?
it's very interesting. And you're absolutely right. A lot of people don't know, and it's a great group. You are part of that group. You've been on the board. You are a great contributor to every meeting ISEPS puts together. ISEPS was founded in 1970 in the United Nations in New York, which is
Mm-hmm.
interesting. You look at those pictures; they are right there at the building in New York City. And the reason was very similar what happened with ASAPs. At the time, most of the international societies were reconstructive societies and would not give space, would not allow much of the aesthetic surgeons in the world to present at their meetings. They were hiding little hotels. It's a very interesting. It parallels very well with ASAPs. So they got together some of the big names that you know, and put together this international society. And for several years was more like a fun travel club, friends getting
Mm-hmm.
together, different countries. And then it really started growing. Um, a lot had to do with the meetings, international meetings, how aesthetic surgery has really blossomed, surgicals, non-surgicals. And today is the largest aesthetic society in the world. We are up to 5,000 members, more than 5,000 members in 106 countries. The mission is very solid. It's focused on education, aesthetic education worldwide, and patient safety worldwide. There's been some tremendous growth. It has really brought the international aesthetic surgeons together, and I'm very proud to be part of it. Very honored to be one of their past presidents, and really enjoy the camaraderie, the friendship, but most importantly, the learning that goes through those sessions, as you witnessed so many times. There's a lot to learn from our colleagues from all over the world. So that's in essence is the International Society.
I would echo all your sentiments, and I would encourage any of the plastic surgeons watching this program to consider joining the International Society. It's a wonderful society, and as you mentioned, dedicated to patient safety and education of surgeons and patients alike. So I'm going to shift gears again on you. You've been around for a while. You've seen a lot of things come from a 16-year-old photographer to a president of these big societies. I want you to look into your crystal ball that I saw on your table there earlier on, that crystal ball. I want you to tell me what the world's going to look like in 3 years, 5 years, and 10 years, the aesthetic world. What are we going to see, Renato, 3, 5, and 10 years from now?
I think we'll continue to see a tremendous growth of the non-surgical procedures. Your vision of 20 years ago, I think the man caves of the world. It's been a tremendous change in our lives. I'm sitting here. The last people that left my office are my 3 master estheticians from Park City. Super busy. One more lasers, one more products, one more. They always come to me with, I want this, I want that. And when you look at the bottom line, they are very busy. In the beauty is the products are better, the technology is safer. So I think that's, to me, I think our generation that we're basically core surgeons, and to see that transition, to me that was amazing. I'm telling you, who has been the leader in that world. But I think we'll continue to see more and more of the non-surgical procedures to evolve. I think there's a whole shift now regarding education in aesthetics. Here we are talking and looking ourselves through the computer, through the digital world. I think our meetings are going to basically change forever. We're still going to get together, we're still going to hug each other, but I think a lot is going to be done virtually. And you know me, I'm very optimistic. I think it's positive. Changes are positive. Changes are important. I always tell my staff, turn lemons in lemonades, which was an old saying in Portuguese. And when I moved to the United States, it's the same saying. And if that's the new world, let's make the best of it. But that's going to be the change in aesthetics, in my opinion, Graham. Virtual consultations. I've done 2 today, brand new virtual consultations. The use of digital. I'm not using charts. I thought I was going to retire with charts. Now I use a software, a new platform for records. It's very fast, and you have to stay with it. Otherwise, you fall behind. So a big growth in non-surgicals, big changes in education, how we do things. The societies have to revamp themselves, or they're going to lose their new members. Why should I stay connected to a society? So it's a big wake up. It's a big disruption. And people like you and I love disruption. We enjoy that, and we take that to the next level. So I think that's what I believe.
I agree with you entirely, Renato. I think the move towards non-surgical and minimally invasive procedures will continue, as you say, and digital and virtual consults and a number of things. Which isn't to say we won't still do surgery. Of course we'll do surgery. but there'll be an emphasis on minimally invasive and non-surgicals. Well, is there anything else you would like to tell our viewers?
I think I read the note that the Herloff, good friend of both of us, just wrote about ASAPs and things that make you happy. And I think one of the points in those 8 bullets was service. And you and I are big fans of service. I know your foundation, you know of mine. You came and you supported. And I always like to bring that up, especially for very successful young plastic surgeons. It's a unique opportunity to be a plastic surgeon these days. I think it's a privilege compared to so many other things. So many people hurting, and we are busy in the middle of a pandemic. Believe it or not,
We're blessed, right?
we're
We're so
blessed.
blessed.
We're blessed. So make sure you
I
serve.
want you to tell our viewers about your foundation. Could you share with us about your foundation? It's so important, Renato. It really is.
I'll do it, but I'll do it very briefly because we all have great causes. We all have.
I know, but this is very important. I know you're reluctant to, but please share with our viewers.
So 23 years ago, because I was so involved in doing breast cancer reconstruction, I noticed, we as plastic surgeons, and you know this, Grant, you've done so many, we are able to now rebuild a beautiful breast and a symmetrical breast. And when you see these patients coming back to the office, at least my impression was, we're celebrating the results, we're taking pictures, we're sharing with our colleagues, we're publishing, and they were so sad, they were so unhappy, and they still depressed. And it just occurred to me that there was something else than just curing their cancer or rebuilding a beautiful breast. So back in 1998, we started offering free 3-day retreats in beautiful homes donated to us in Park City. And that's how the Image Reborn Foundation was started. And basically, these breast cancer survivors come from all over the country, and now even from Europe and South America. And they spend 3.5, sometimes 4 days with moderators, with volunteers, and they have the time of their life. And they have yoga, they have massage, they ski, they ride horses. We have chefs that come and prepare food for them. We have psychologists that come and deal with their frustrations. We have groups of stage 4 cancer. We have groups of young survivors. We have a group of Hispanic survivors. We divide it by different groups, and we address their needs during that entire weekend. And we have passed over 4,000 breast cancer survivors. It's been 23 years. We have 1 or 2 retreats a month, as long as the budget allows us to do it. Obviously, with COVID, everything turned to virtual. We continue to offer retreats. We had over 30 virtual retreats last year. And it's been the greatest passion of my life. That's where most of my time and finances have been. And now the foundation has grown. We have supporters everywhere. But it's been a very, very good for me. And I always share this with young colleagues because, find a passion, find something. And it doesn't need to be just golf or cars or fancy things. Help your community, give it back, because it gives you a tremendous satisfaction. It fills my heart every time I go to a retreat. And I still attend every retreat. I go there for a couple of hours. I talk about scar tissue. I talk about, how to manage certain things. But today the foundation has grown a lot. We have a terrific board. We have over 100 volunteers. We have industry supporting us. So it's been a great experience, and thank you for allowing me to share that. I'm very proud of it.
And everyone, that's called Image Reborn. And I've had the opportunity to participate with Renato and see the love and dedication that he has for that nonprofit organization that he and his lovely wife Flavia support, as well as his whole entire family. And Renato's also a recent grandfather.
That's right. Brand new baby.
Congratulations. Yeah.
Brand new baby.
Well, this could go on for hours. I want to thank you so much for
Thank you,
being a
Grant.
guest on our show, The Technology of Beauty. I want you to go home and give Flavia a hug and a kiss from Granto, and give all my warm wishes and Aaron's wishes to your entire family. We love you and miss you very much, and I look forward to seeing you.
Thank you so much. Thank you for the opportunity. And I love you, and I'm so happy to see you so healthy and handsome as always. And I'll give you a big kiss and a hug in less than a month in Miami Beach.
I think you need your eyes examined, but thank you very much for the lovely compliment. Your patients are in trouble. I want to thank all of you for joining us this wonderful episode of the Technology of Beauty, where we get to interview the movers and shakers of the aesthetics and beauty business. Please join us each and every Tuesday. Take care.